On today's podcast,
things that are unique with Babesia with the parasite is that it can be one of those persister bugs. And typical treatment for Lyme isn't necessarily going to be an antiparasitic. So you're not really addressing the parasite component of it. And then Lyme will find its way to hide within parasites, generally speaking. So it provides sometimes a home as well for that.
if you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Hi, everyone, and welcome back to the podcast. But before we introduce our amazing guests, I want to say hi to my just as amazing co-host, Dr. Emmy Brown. Good morning, Dr. Emmy.
Good morning, Jen. How are you doing?
Oh, I am good. Still waiting for the sun to come out in California. I'm good. Super excited about today. Today we are joined, and I have to use my hands here, Dr. Summer DelSignore, a distinguished pediatric and adult Lyme PANS mental health specialist that has earned her international recognition. Dr. Summer is the founder of Hudson Valley Integrative Health, and she has been treating children with tick-borne diseases for over 20 years. In this episode, we will discuss the complexities of pediatric tick-borne diseases and neuropsychiatric disorders. We'll talk about the symptoms of these conditions, the challenges of diagnosis, and the latest treatment options. Her groundbreaking research has shed light on complex and often misunderstood intersection, providing hope and answers to families and healthcare professionals alike. Dr. Summer is a wealth of knowledge on this topic, and I am so grateful to have her on the show. So get ready to have your neurons fired up as we dive into a topic that will challenge our preconceptions and leave us with a newfound appreciation for the inner workings of the human brain. Welcome, Dr. Summer.
Thank you. Thanks for having me. That's quite an introduction.
Well, you've earned it. It's so nice to have you here. So I'm going to kick it off, Dr. Summer, and I want to throw it out here for our listeners. I'm somewhat of a novice when it comes to tick-borne infections in the pediatric community, and I'm sure a lot of our listeners are also. And then the associated neuroinflammatory conditions that can so often come along with this. So we're going to start off with just laying really foundational groundwork for everybody, and so that we're all in the same boat, okay? So I'm really wondering, how did you get into integrative medicine? I know you started out on the conventional side as a nurse and then eventually nurse practitioner. So I'd love to know, was there one pivotal moment? I'm sure it was a collection of a bunch of little things, but what really stands out to you in terms of switching over?
Right. So so my training originally was in the pediatric ICU at Children's Hospital of Pennsylvania, at CHOP. And so there was no discussion of tick-borne or chronic illness or neuroinflammatory outside of an acute realm. Eventually, I transitioned into primary care. The pace worked better for me at the time. And then also in integrative medicine. So it was an integrative pediatric practice, which was pretty cool. And it was new to me. It was new at integrating that component of health, wellness, natural focused, care with conventional. And the patients that I would see would come in with tick bites. Again, I'm from the South. There was never any mention of Lyme disease down there. We moved up north, I guess, about 15 years ago. And I started to see kids who would come in with tick bites, and I would treat traditionally, okay, here's your so many days of antibiotics, send you on your way, you should be fine. And then the kids would start coming back and they weren't well. Or the parents would bring them in and say, hey, there have been some mood changes, or my kid's stumbling more. They're having these weird fevers or just odd kind of symptoms. And you just begin to ask the whys, right? Those questions. Why? Why is this happening? What am I missing? And we would start testing. Some colleagues would say, hey, Lyme disease, other co-infections are a big thing up here. There's a Dr. Horowitz. He doesn't treat kids, but maybe you should tap into him. And that's kind of what led that journey. And when I first met Dr. Horowitz, just to have that discussion, he's like, you're like one of the only pediatric providers even tackling this at the time. And this was about a decade ago. And he goes, so I'm going to train you and we're going to go through this. And that's kind of how it started. So it was just sort of that anecdotal evidence that we all, as scientists, practitioners, see those trends. And then you're asking those questions to kind of get to that root cause. So I think that if I were in any other type of practice that didn't have that integrative kind of root cause medicine, I probably would have missed it because you wouldn't see that kind of return like you do.
Right. It kind of found you.
Exactly. So it found me. So it was never a quest. It wasn't a personal experience. It wasn't a quest to do it. And I just sort of fell into it and it worked. And it was just right for me.
Now I'm curious if you always had an interest in working with children, or if, it was just a kind of like you said, you sort of fell into it. And by the way, I've seen a lot of websites. Dr. Summer, your website warmed my heart. The picture of the little girl, if you haven't checked out her, whoever's listening, go check out her website. It made me smile ear to ear. Beautifully done.
Thank you. Thank you. I've always been pediatrics, always from day one. It was funny going through undergraduate studies, the theme is always, hey, well, you need to do a general practice after you graduate. And I said, no. At the time that my 22-year-olds have said, I don't want to deal with stinky adults. I have no interest. So it's always been I treat adults now too. It's fine. But it was always pediatric. I've always had a love of children. I was raised in a family where both of my parents had 5 brothers and sisters each. So there's like 15 first cousins. I'm always around kids. I've always loved the idea. So I've always been kids, always pediatrics. So that was never a question.
Yeah.
And you're in the Northeast, right? So
Yes.
you have this crazy concentration of tick-borne infections. So, and of course, everyone thinks Lyme right away. But before we jump into kind of the nitty gritty, what would you say the top 3 or so tick-borne infections? What are those that you see in practice?
Within my population, it's primarily Lyme disease, Babesia, and Bartonella. And that seems to affect children significantly. So.
And then what about, so I have to ask, because there's some disagreement in terms of how Bartonella is passed on or transmitted. Is it tick or is it not?
It's both. It's both. So we'll call that argument. So it can be tick-borne co-infection. It can also be from lice and sandflies and fleas. It's typically, the layman's term is cat scratch fever. And It's not the cat. It's really the fleas on the backs of the cat. The cat scratches the flea in its excrement. It's awful sounding, and then it scratches you and introduces the bug. I see it quite often, not as often with the cat scratches, but more with lice with kids, because it infects the classrooms, and then you'll see this uptick in kids that have it. There is a thought too that it can be passed congenitally, and there's data coming out to support that, and then that creates a whole squabble as well within the community. But there is scientific research that is showing, hey, there's a transmission. So it is tick-borne, and it's from other vectors as well. It could be both.
Good to clarify there.
Yes. Yeah.
And then also to get some clarification, switching to Babesia. Babesia is a parasite.
Correct.
So we think about parasites complicating the treatment of other infections. What is it about Babesia as a parasite that complicates treatment of concurrent Lyme? Is that an issue you run into?
Yeah, it's a protozoa parasite. It's malaria's cousin. It loves your red blood cells. So there are other issues that kind of contribute to that complication with tick-borne. So anytime, with Lyme or any other co-infection, if you're stacking infections on the immune system, eventually it's going to fatigue out. So whether it is Lyme by itself and reactivating an underlying infection, like EBV that maybe you had much younger, or anything else, the immune system will tap out. So you have things that are unique with Babesia with the parasite is that it can be one of those persister bugs. And typical treatment for Lyme isn't necessarily going to be an antiparasitic. So you're not really addressing the parasite component of it. And then Lyme will find its way to hide within parasites, generally speaking. So it provides sometimes a home as well for that. So when you have kids or adults coming in, practitioners, even me as an integrative, I'm not necessarily going to put someone on an antiparasitic protocol. There are side effects of those meds. It's an intricate regimen, and you have to be quite careful about it with liver and kidney function. And then understanding what parasites in and of themselves can do to a person because of the red blood cells. You have a lot of liver complications. You can have congestive heart failure issues. You can have, platelet issues, severe anemias, parasitemia. So some really significant issues especially in those people who are immunocompromised, which could be very, very young children and then very old. So it just comes with its own host of complications, and then as a co-infection, and then compound that.
You took the words out of my mouth. Complicated is kind of what
comes
to mind. Yeah.
Right.
So for the practitioners that are listening that maybe don't focus on tick-borne or these co-infections, what are some of the common characteristics in the signs and symptoms that you see in your patients?
Well, it's interesting because Lyme disease is, known as the great imitator. So there are a host of symptoms that present, and you really have to kind of nail down that context of exposure and when it happens. So you have people who present with typical flu-like symptoms. So, fever, nausea, malaise, fatigue, headache, visual changes, dizziness, things like that. And that can be a million and one things, honestly. But then you start digging deeper and you see things like autonomic nervous system dysfunction, something called POTS dysautonomia, where there's blood pressure dysregulation. That's a big one. People will come in with severe fatigue. If it's really bad from a Babesia parasitemia, you'll see people who are jaundice, who look like they're in liver failure. I've only seen it once, thankfully, but it happens. You have with the children, I often see a very large neurological impact. So the kids will come in with a motor dysfunction, regressive behaviors. They're missing milestones. There's major mood and behavioral changes. They're not sleeping well. They're complaining of headaches and they're bedwetting and issues with GI. They're not eating, or everything tastes awful to them. Oftentimes with those symptoms with kids, I find that there are the neurological impact, which would then trigger providers to go down more of the mental health pathway versus saying, let me look at you from an infectious disease perspective and see what's triggering these behaviors. And all of those infections overlap. So you see, things with Bartonella specific to Bartonella can be lymph node swelling, neuropathy. So that's the numbness, burning, tingling, or crawling sensation that you feel in your extremities or all over your face, traveling down any nerve pathway. Oftentimes you can see some odd rashes. It almost looks like little sunburn patches. It's not an EM rash where you see the central clearing, the bullseye. It's not that, but it's sort of like random rashes that'll kind of come and go. Or you'll see something called striae, which looks like stretch marks with a kid who is a normal BMI shouldn't just have stretch marks popping up, right? So, but they come and go. The Babesia people will complain of, day sweats and night sweats. And I always joke with either the male patients or kids to say, you're not going through menopause, I promise. So it's so the flushing fevers. And then you'll also see an uptick of other illnesses. So either uptick in allergies, uptick in viral infections, upper respiratory, that's abnormal for that person.
So there's tons of overlap, but you have this collection of signs and symptoms. And when you see that presentation, I'm wondering, what kind of approach do you start with, especially with the pediatric population compared to a conventional approach? I think oftentimes providers think about, okay, they can treat Lyme in the acute setting. It's, pretty straightforward, right? But what kind of laboratory testing are you using? And also clinical assessment tools. I mean, many providers are aware of Dr. Horowitz's MSIDS questionnaire. What kinds of things do you like?
Well, Dr. Horowitz was my mentor, so I do use sort of an MSIDS approach, and it's head to toe. I think that the mistake that we make in conventional medicine is siloing systems because we have so many specialties, right? So instead of saying, oh, this is just a neuro problem or a GI problem, or cardiac, we need to connect those dots and look at them head to toe to say maybe it's an autonomic nervous system issue, and that's why they're having head to toe issues. So I think the approach is definitely that root cause focus to do a lot of investigation. You typically have a parent or guardian there as the advocate with kids, which is nice. And to go through the history to say, okay, historically, how has your child been? Were there always frequency of these symptoms, or is this brand new? Were there exposures? Where have you traveled lately? Were there any odd infections that you had prior to presenting with these symptoms that were more acute in nature before presenting here today? And that clues you in on kind of where to go. Parents who are great historians make it easy to say, okay, well, let's just go down this path. Let's go ahead and test. We'll do the vibrant wellness testing. I like the finger stick. It's not as traumatic for the kids, so it's nice. And then, or if you're presented with someone who's just not sure, You start head to toe. So you start with basic labs. I will do infectious disease workup, Lyme and all co-infections. I'll do all opportunist viruses, and opportunists are, we hang on to viruses for the most part. They go dormant in our system as long as your immune system's intact, but they can resurface and reactivate. So EBV, sometimes things like Coxsackie, which is hand, foot, and mouth, very common things that we've all had.
Yeah.
I look for strep. I look for mycoplasma. I do gut studies. I do autoimmune panels. So it's a barrage of tests. I go head to toe. I look at adrenals. I look at thyroid. If someone says fatigue, it may not be tick-borne. It may be an adrenal dysfunction.
Mm-hmm.
We'll identify that. And then I'll go from there and do root cause analysis on that. Well, why are we having an adrenal dysfunction? And kind of back it up. Is it a mold exposure? Is it environmental toxins? Is it, do you live near certain military bases and your water is contaminated, or near orchards where there's glyphosate and very high levels of water? So it was kind of taking that head to toe approach, and also looking at an environmental kind of approach too, to say, what are the other exposures beyond, so that could be contributing to this. So that initial assessment is pretty comprehensive. Consults with me are minimally an hour just to get that started. And then the follow-ups are then, pretty extensive after that too, to kind of drill it down.
Yeah, they have to be.
Yeah.
And then in terms of the history component, you mentioned this before, but passing tick-borne infections from mom to baby, congenital Lyme, is that the correct term? Is it a thing? What are your thoughts? And I know this could be a whole nother podcast, but just quickly,
absolutely.
Again, the groundwork.
So to summarize it, yes, there is, and it all started anecdotally, where we would have moms who actively had an infection, had a laboratory confirmed tick-borne illness, whether it be Lyme, Bartonella, Rickettsia, Babesia, whatever. And their child would also then test positive. Baby would come in with symptoms, and we're talking under a year, hasn't been anywhere. And once that child had their own robust immune system, because you can't just test the baby under a certain age because it still has mom's innate immunity. But after a certain period of time, we would test them, they would be positive. I'm like, interesting. Okay. And the baby would be diaphoretic and have day sweats and night sweats, would be colicky, poor feeder, would be floppy, and have some hypotonia, some things that were, out of range. You would test them and see the positivity. And it's like, well, this child hasn't seen grass. Child hasn't, to be outside, to have a tick exposed, hasn't been around a pet, hasn't been around any other vectors that could potentially pass this to them. So that was kind of where that started. And then, the research is now showing that, yes, it is being passed. It's something that those of us who've kind of been in this field for a while know, and based upon that anecdotal evidence, but now the actual research is coming out to say, yes, we've been doing these studies, and we're now seeing that is being passed to those children.
I would love for you to share that story of the 5-year-old boy who was born to a mother that had the active Lyme and Babesia. Walk us through that journey, if you don't mind.
Right. So the mom was actively being treated by Dr. Horowitz for tick-borne illnesses. She had Babesia, Bartonella, Lyme disease, and he was actively treating her while she was pregnant. And she had her son, and he began to exhibit symptoms as well, primarily motor and neurological symptoms associated. And he was diagnosed with autism spectrum disorder by his primary. So we had aversions to food. He had missing developmental milestones. He had hypotonia, major light sensitivities, generally speaking, and he was nonverbal. So she actually took him to see Dr. Horowitz, and he said, no, because Dr. Summer, I don't deal with kids. Here, So I took him on. It was nice to have her background. We tested him, and he essentially mimicked what mom had with testing. And I began treating him again, peeling back the layers. We started to address detox pathways. We started to address the tick-borne illnesses that did pop up very slowly, and watching him. And everything in peds is weight-based. So the medications are weight-based, so that we're watching it closely. And ultimately, we ended up putting him on a Dapsone protocol, which Dapsone is okay, they're safe, it's a safe panel drug for kids 4 years of age and older. So we waited him to reach that age to trial it. I wasn't willing to push it further with that med, and to ensure that he would tolerate those other supplements and medications to support him when we use that protocol. And so over the course of several weeks, we're talking a couple of weeks within starting those protocols with dapsone, the associated antibiotics, methylene blue, which was really there to offset dapsone. But we found that he started speaking. And speaking a few words turned into shorter sentences and then longer sentences. And then his personality started coming out with his personality true to him. He started to engage socially with other kids, and he would stimulate that engagement. He would go to them, hey, let's play. And the kid was, nonverbal. Eventually, he started eating on his own. He had a G-tube because of the sensory issues. And I think that sort of one of the pinnacles was that over Thanksgiving, the mom told me, she goes, Ethan's sitting at the dinner table with our family, and he's having conversation, and he's making eye contact, and he's eating a plate of French fries. And he looks at mommy and he goes, Mommy, these are the best French fries ever. Just like you would expect with a 5-year-old kid, right? So definitely one of those success stories where then it raises those other 1,000,001 questions of, is autism really, kind of a set thing, or is this more of an underlying infectious trigger that's mimicking those symptoms of autism? So then it kind of raises that question.
Yeah. And I really want to go there, and we're going to go there, Dr. Summer. But before we do, this is a kind of a good segue to squeeze it in real quick. We're talking about mom during pregnancy diagnosed, you said it was Lyme?
Yes. Lyme, she had Lyme, Babesia, and then underlying Bartonella.
Okay, Lyme, Babesia, Bartonella, receiving treatment, yet passed it down to her child. So just thinking about, and I would love to know what you think about terminology, persistent Lyme, chronic Lyme. You talk about researchers, doctors, Kim Lewis and Ying Zhang on your blog, and this fascinating concept of persister cells.
Yes. Yes.
So I just would love to know about, what are persister cells? It looks like they're protected by biofilms, and despite treatment, is this what's contributing to this persistent Lyme, if you want to call it that, or other?
Right. So it appears to be that biofilms and fibrin nests contribute to more of that persister form. Traditionally, treating Lyme disease, we approach it with medications that focus on cystic forms, on intracellular forms, on cell wall forms of Lyme and other tick-borne vectors. And despite piling those med combinations on board that makes anyone cringe, we'd still have sort of the persistent infections, and not necessarily just the symptoms, but lab work would also show, hey, this is still hanging on. It's not converting. It's not going away. And then Zhang's research certainly was a major contribution into the way we now approach that treatment, is saying, hey, these bugs are finding ways to get cozy and hide and evade treatment. And we have to go after those things. And those are those biofilms, which is a sticky substance that we all have. We all have in our bodies. It's just dead cellular debris. And these bugs can kind of hunker down and get underneath that. And the antibiotics just kind of pass them by. And we're talking antibiotics from the pharmaceutical sense, and then natural antimicrobials from an herbal sense. It didn't seem to touch it. But when you start to break up the biofilms, then you start seeing movement. And again, also fibrin nests. So that's another component. So they're very stealthy bugs. They know how to hide. They know how to survive. So that is a huge component of a treatment regimen. So whether it is just a persister bug, or just, we haven't necessarily caught up with ways of treatment. I think we're getting there, thanks to Dr. Zhang and others' research. I think Dr. Ava Sappi as well, out at University of New Haven, is doing some really great work as well. But, I think it's really just related to kind of really understanding the environment of that bug and how it will morph, and the resiliency of those bugs.
Right. Yeah, it's incredible. They're hardy bugs, those fire bugs.
Yes.
and the co-infections. So,
Right.
What about the term post-treatment Lyme disease syndrome? Do
I
you
don't
use that term? Do you like that term?
I don't. I think it's a lazy term. So I think that with any underlying chronic infection, whether it be tick-borne or, viral, like I say, I keep going back to EBV because most of us have it and it's dormant. I think that there is always a degree of immune dysfunction that occurs with anything. And so that post Lyme is more of an immune dysfunction. I think that it can certainly also be related to other untapped, untreated infections, whether it's still lingering Lyme and co-infections or other things that are more opportunistic like viruses or mold exposure, what have you. So I don't think that we look at, and I take issue with that term because then it's like, oh, okay, it's just you're just gonna have to deal with this. And that's sort of the context. I don't like that. I don't think anyone should have to deal with anything from a health perspective. I think that we need as providers to really continue to dig and provide that service that those patients are looking for that root cause effect. And again, it may not be residual underlying infections that are remaining. It could be now because of these infections, they have these sort of autoimmune tendencies or adrenal dysfunctions or thyroid dysfunctions that we need to correct. So it's just taking that next level of, all right, let's dig further. And now let's look at more regenerative type medicine and focus on getting you back to health versus just labeling you and telling you to deal with it. So I put that term in the same bucket as I put things like chronic fatigue syndrome, which I don't like that one either. It's sort of like, well, we haven't done our job. We haven't figured out root cause. So, yeah.
Right. Yeah, that's such a great point that we need to dig deeper. And it's both. It's maybe they still need some treatment, and there's other things we need to look at in terms of the environmental exposures, adrenal function, etc. So yeah, great point. Thank you for walking me through that. I think it's something that a lot of practitioners, they tiptoe around, and we don't even really know how to refer to it if we're not comfortable in that space.
Sure.
So that's helpful. And so now let's transition into some of the neuroinflammatory complications that may occur, that may co-occur. So is there a link between pediatric acute onset neuropsychiatric syndrome, also known as PANS, and Lyme and co-infections? Take it away.
Yes, emphatically, yes. So, neuropsychiatric disorders, PANS, pandas autoimmune encephalopathy, is sort of a blanket autoimmune diagnosis for another underlying trigger. So originally it was Dr. Sweeto and her research was, it's strep related. And strep triggers pandas, and there was this subset of symptoms with motor vocal tics, behavioral changes, cognitive dysfunction. And then as we continue to kind of dig through and gain more data, you're seeing that it's just more of an autoimmune component, and any underlying infection can trigger. So yes, tick-borne can. So whether it be Lyme disease or Babesia, particularly Lyme and Bartonella, always, also have an affinity for the neurological system. So again, it's more of a compounding effect. The symptoms of a tick-borne PANS flare is the same as a strep, essentially. I mean, you still get that same neuroinflammation. So you get the mood disorders, the motor vocal tics, sometimes bedwetting, fears, anxieties, OCD, food restrictions or aversions, multiple personality, mood personality, which I had a patient who had 200 personalities as a result, as a result of a PANS situation that was underlying tick-borne. So, and as we treated, she improved. So
less personalities.
Just one personality down to her normal self now.
Good.
So you just have to view that as, and I get that question a lot because a lot of parents try to tease the two apart to say, well, is it PANS or is it Lyme? And then you say, well, it's both, because the PANS isn't really an infection per se, it's an immune dysfunction. So you have to kind of explain it that way. And I see that online a lot too, either questions directed at me or on some of the PANS networks or the Lyme, Facebook, whatever forums, the parents are on. And you see that. So it's the umbrella of that. And then underneath is the root cause, the infection, the trigger for that condition.
And not just strep in terms of pandas, right? It could be strep and tick-borne
It could be multiple.
infections.
There's no rule
Right.
that says that you only have one infection. Some people are very delicious in infections just like them, and they have lots of bacteria and parasites and mold and viruses, and they're full of it, And so, yes, it can be multiple things. So, when you're approaching these kids, and kids meaning, young children up to young adults, because again, the blood-brain barrier doesn't close until you're about 22 to 25 years of age. So you're still vulnerable. So there are young adults essentially who can have PANS. And I know that many practitioners out there will tell parents, oh, your kid will grow out of it. And I guess they're assuming that, oh, well, when your blood-brain barrier closes, you won't be as vulnerable or susceptible to it. But many times that's not the case.
Yeah. And that reminds me of something a mentor told me. She said, patients are allowed to have more than one thing.
Yes.
It might be easier for us as clinicians to say you have this one diagnosis and this one etiology.
If only it were that easy.
Right. If only. So, okay. So what about relevant autoantibodies? Antitubulin, for example, antidopamine. Are you testing those markers and monitoring them?
I do test them. I used the Cunningham panel originally. And then I recently flipped over to the Vibrant, the NeuroZoomer test, which I like that. And I like that I can also see some of the antibodies related to certain infections that will also show. So it's nice. It's a nice guide. Yeah. But I do follow those. And as we're treating, to kind of give me a sense of what we're affecting from, treating underlying bugs that I'm finding in addition to that autoimmune component. And then that also gives me insight into things like, do I need to take that next step and prescribe, IVIG and plasmapheresis? I mean, so it kind of gives me an idea of that as well. And then when I see residual symptoms in certain patients that may then have those neurological antibodies are converted negative and we still have certain symptoms, it's like, well, okay, we need to approach this a little differently.
Peeling back layers.
Exactly. Pull back layers. Yes, absolutely.
We should add detective after.
Like forensics, right? Sort of cool, like NCIS or what? Yeah.
So in another article that you wrote, Dr. Summer, the title was, "It's a Gene Environment Immune Complex, How Mycotoxins Impact Lyme, Autism, and PANS." You discuss how mycotoxins play a role in the gene environment interaction, affecting the neurodevelopment and causing immune reactions that result in elevated cytokines, inflammation, and oxidative stress. Can you connect the dots for us about the link between, this toxic mold and PANS?
Sure. So generally, to put it simply, it's almost like a mast cell activation is what happens. So we have, mold, which is very inflammatory to the body, and like any other sort of fungal or things or parasite fungus that kind of put over here to say they're very resistant at wanting to leave their host, so anytime you're trying to kind of provoke and treat, you get a massive inflammatory response from it. And from that, you're getting this massive mast cell activation syndrome from those cytokines, and contributing to this major immune dysfunction. And when you have that much inflammation triggered, then the immune system can't focus on anything else. It can't focus on other underlying infections. So you sort of have like this hijacking from the perspective of the mold, which is triggering inflammation. And the body's always about balance, right? The immune system's focused about that on balance. And we sometimes think of the immune system as just infection, right? That we're just trying to treat infection, but it's there to filter out everything we're exposed to. And if you're doing a good job, you're fine, you're healthy, you don't necessarily have allergies or things like that. And if you're tipped a bit, then you're going to be reactive to everything. So that's sort of a very simple way of kind of viewing it, is that the inflammation is kind of what, throws a wrench into the body's ability to balance and try to deal with the underlying infections that are there. And I find as a clinician treating patients, who have underlying tick-borne infections or other infections, if we're not moving the gauge, I'm looking at environmental, I'm looking for mold to say, okay, from a neurological perspective, you have all this neuroinflammation, we're moving the antibodies, we're converting things negative, you're not having other physical symptoms, what is it? And then we're seeing with a lot of times it's the mold that appears to be causing more immune dysfunction or suppression or neuroinflammation. And then you start to bind and clear it out, and patients are saying, well, I'm feeling better. So it's not always that simple, but generally it's okay. I'm feeling movement now that we're moving that along.
Yeah, that makes total sense.
Yeah, I'm just thinking about a big old knot, that you're trying to untangle, and it takes time. And telling patients up front, I think this is helpful for providers maybe just getting started, is it's a process. I mean, obviously that this is read between the lines. You've been saying that this whole time, but really it can take some time. I'm thinking upwards of, are you working with people upwards of a year on this?
Right. At least with some.
Yeah.
And it's definitely worth having that conversation with patients and managing expectations.
Yeah.
Because we live in a healthcare system that is a very acute focus, right? You go in with an illness, here's your 10 days of whatever, and you should be fine. So there are a lot of patients who will get frustrated saying, well, I should be better by now. I should be well. Well, based on what? So it's really very much managing those expectations and letting patients know, as long as we're moving forward, view this as a marathon, or in some cases, view it as a trudge forward, that you're making steps, and sometimes it takes time. Your immune system is going to kind of guide this. So it's going to kind of be up to that. And then also there's a compliance arm. People are not used to taking multiple supplements and dietary changes and medications for long term. Everyone's looking for the quick fix and the silver bullet. And so it's a big, big change, a big shift in what we think of in healthcare. And also the shift is and how we view wellness. So, to your point, it's a very good point that managing expectations is very important, that this is more of a longer road.
Right. Marathon, not a sprint. I like that. That's a good takeaway here. Okay.
Mm-hmm.
Okay. So now we're going to jump into thoughts on possible tick-borne infections and autism spectrum disorder.
Yeah. So the neuropathology of autism and Lyme cross paths quite a bit. And there were some studies, they're post-mortem studies, several years ago that kind of dissected tissue of kids who had autism, looking at brain tissue and saying, yes, there's a frontal cortex issue, there's a cerebellar issue with it, but about 25% of them had evidence of neuro-Lyme that was undiagnosed. And 25% is a pretty hefty percentage. If you're thinking about post-mortem kids, not those who are active and living right now, I'm sure that there's more. So there does appear to be a direct link with undiagnosed Lyme and autism spectrum. Now, with that said, because it always kind of stirs the pot, to say, oh, it's all infection. It's not all infection. There are many contributing factors to autism spectrum.
Of course.
But I have to question the rate of acceleration of autism diagnoses that we're seeing, where it was one in several hundred way back when, and now we're up to like 1 in 100 and 1 in 20, 1 in 5, as the projection is sort of like 1 in 5 or something to that effect. Don't quote me on that one, but it's a significant number. So then you have to ask, well, what's fueling it? What's the driver? It can't just be, a biological mutation on some level, but there has to be something else here that's driving it. So it appears as though there is that underlying infectious trigger. And perhaps we can also start watching those congenital Lyme numbers and compare them to the rate of autism spectrum diagnosis.
Yeah. And I'm wondering, is there, I don't know if this has been identified yet, but maybe a genetic predisposition, because exposures are so great in terms of tick-borne infections.
Right. So genetics, that's a slippery slope, because we know we all have genetic SNPs, which are usually like enzymatic processes that change, not necessarily a syndrome, but where you just don't, something doesn't work quite well from a conversion perspective. So those are those genetic SNPs. I know that there has been a lot of talk about the autism gene, but it's not foolproof. So there isn't a direct link to that. There's just a higher rate. I do find that kids who have a lot of the MTHFR mutations seem to have some of those spectrum-like symptoms. Not always diagnosed, but the majority of the time I do see that. Mm-hmm. So it does appear to be a the body's ability to methylate or convert B vitamins appropriately and use them, it appears to be that there are certain genetic SNPs that contribute to detox pathways that aren't functioning appropriately. But it kind of all seems to come back to the ability to absorb the right nutrients and inflammation. So it's interesting. There is definitely that genetic link, but I always caution patients to say, don't live by that. It doesn't mean, right, just because, to put it in more layman's terms, I always talk to patients to say, look, you could screen positive for a BRCA gene. It doesn't mean you're going to get breast cancer.
Yes.
And I kind of put it in that context with everyone to say, don't live by that. It does play a role. Yes, we do need to watch it, and we need to support and nourish the body appropriately if you do have some of those genetic SNPs, to say, okay, fine, I can give you extra B vitamin or folate, folate, B12. It's not a big deal. Or we can push the detox pathways a bit more, and talk about healthy diets and other ways that would be good for your health in general.
Mm-hmm. Yeah, it's also the epigenetic feature of all of this, which is dimming down the light switch or bumping it up. We can't turn on or off genes, but there's things that we can do, although that's just one of so many other things, right?
Right.
So yeah, really, really important to remember that it's not the end all be all, and people get so caught up in genetic testing, I find, and useful. It's a yet another useful tool.
Yeah.
Yeah.
Exactly.
Okay. And then on top of that, just to mention, then you have the gut-brain connection.
Right.
So kids with digestive complaints, I mean, I'm sure you see a lot of that, right?
I do. Absolutely. So and the gut-brain connection, kids don't always come in with complaints of GI.
Great point.
Right. So it's not always that, but this other behaviors. I've diagnosed gut issues with kids who came in with neuropsych, to say, wow, you have a lot of inflammation. You have a lot of, general allergies that are triggering this underlying low level inflammation. And we know that that's where our innate immunity starts and where our neurotransmitters kind of stem as well. And they're not making it where they need to go. So you're being diagnosed with this neuropsych issue. Someone is piling on all of these SSRIs that are not working because it's not necessarily the problem. But if we can kind of get rid of that inflammation, get your gut working to ensure you're absorbing nutrients, get inflammation down, support the immune system, support neurotransmitter development, then we're in a good place. So there's a huge, huge component. With inflammation, you can develop leaky gut. And the thought of that is, oh my gosh, all my GI contents are spilling out. It's just, because I've had a few patients that were like, no, that's not coming out. It's more from a micro level of the cells are not, that epithelial wall cells not quite as tightly bound as it should be. So antibodies can pass through and they get into your blood system systemically, and then can make their way up and cross the blood-brain barrier, which again, under that 22 to 25 years of age is not quite as tight either. So it's more vulnerable, so things can pass over. So that's sort of that connection. So if there's things brewing in the gut, whether it be, like I said, allergies or just general imbalances with bacteria, like dysbiosis, or having that true leaky gut, then yes, you can have those symptoms occur. So you just have to kind of shore it up. And that goes a long way with a lot of patients. And oftentimes they want pills, give me a medication to fix it. Well, you're going to have to do this the hard way. You have to roll up your sleeves. You have to change your diet, and to take away mac and cheese and chicken nuggets from a 5. It's off. Right. I know what I'm asking. You have to. I get it. I remember those days. But, trying to change it up in a way that kind of supports an environment for those healthy bacteria, those probiotics to grow, support healthy enzyme processes so they're breaking down food appropriately and absorbing it appropriately, to kind of help shift the bacteria that's there. So it's not as quick as just, here's your XYZ medication and it's going to fix it, because then you're on that cycle of always needing that medication and never being able to step away. Right. We could talk about this all by itself, the whole gut.
Yeah.
That's a whole nother discussion.
Yeah. We have to have you back, obviously, a few times to finish all these little rabbit holes that we could go down.
Right.
But I do want to kind of switch gears as we're starting to wrap up, Dr. Summer, to more prevention and creating awareness. Now, I actually grew up in the Northeast up until I was 20-some, and I started moving around, where camping trips were the norm, right?
Yeah.
And I remember us coming back at the end of the day, we'd get tick checked. My parents would strip us down.
Yes.
But I have to say, and it was ignorance on their behalf because it wasn't, a very known thing. They weren't very proactive in their attempts to minimize that opportunity for tick bites. What can you tell parents nowadays when it comes to this topic, strategies that you could encourage them to reduce the risk of tick-borne diseases?
Right. So the first step is to be aware, right? And know your environment. And understand that ticks like to live in shady areas and brush. If they have an exoskeleton, they dry out and die very quickly. If they're in a very hot environment that is with low humidity. Mm. So so you keep things like the grass around your house short if you can. You keep, any brush and shrubs cut short and kind of keep the perimeter of the house nice and neat. Or any environment that you're in. You create barriers. So things like wood chips, like beds, things like that will prevent them. They're not going to cross over at risk of, dehydrating and dying. Mm-hmm. Always tick checks no matter what. And, camping trips and trips like people are more aware of that. But I think what gets missed are the daily, like go outside and play kind of a thing where your guard's down a little more than it usually would be. But definitely checking for things the size of a poppy seed, or larger on your kids and definitely stripping down, checking pets, trying to discourage pets from sleeping in the same bed, which a lot of people do. We have pets, but they have their own area. They stay away. And then using repellents. And there is a lot of concern about things like DEET, permethrin, things like that it can be neurotoxic to very young children. You can spray it on the shoes, on the bottom of the pants, legs, things like that. But then you can use natural, oils that are tick repellents as well that are perfectly safe to use on pets, to use on kids and anyone, but you just have to reapply. Make sure that everyone is, wearing light colored clothes so it's easier to see. So just some really basic things, and understand that ticks are actually on the beach too. They found them in the sand. So
oh no,
they don't know where we go. I think we live in bubbles. At this point, I'm like, forget about it, whatever. But just always check yourself when you're out and about. And then my other thought is not that it's a popular one, but decrease your carb intake. So the more carbs you eat, and some of the more CO2 off-gassing. And that's where bugs will chase you. They're like, oh, it's a meal. They're chasing you. That goes for ticks and mosquitoes. So
interesting.
Yeah.
Well, now it makes sense. My husband always says him and my kids are prone to mosquito bites. I'm going to tell him you got to stop eating carbs.
Right. Yeah. Same in my house.
That is
yeah.
No dessert for you.
Yeah. No, a lot of those were basic, but extremely helpful. Do you have any favorite resources that you would recommend to parents or providers alike that want to learn more about this topic or prevention techniques?
Oh boy. Well, you could start with my website. That's a good one.
There you go. That was the plug I was trying to get there.
There's a plug. Yeah, start with your website. And there are multiple Lyme foundations out there who will provide information on their websites. So any of them, that I can even think right now of them. There are so many of them. But no, you can start with my website and kind of go from there. And then you look at some of the other practitioners who have been around for a very long time, who have their own blogs and websites as well, like Dr. Horowitz, Dr. Shore. You have the Bachs, both Steve and Ken Bach, who do some Lyme and PANS as well. So there are multiple. All you have to do is sort of search it and go from there. It's there. People want it.
It's out there, right? You just need to find it.
What about favorite treatments right now, Dr. Summer? Any compelling research that you've been reading? I know you do ozone.
Yes. Yep. There are a couple of nutraceuticals that other colleagues have joked about with me to say you bathe everybody in this stuff. So I love some of the herbal treatments, things like cryptolepis, artemisia. I love, and then things like cementobanderol, hutania. I love Research Nutritionals, BLT, Mike P, and Crypto Plus. That's sort of like the trifecta. I'll start with that one because it covers a host of things, as long as you don't have allergies to certain things like black walnuts and things like that are in there. Right now, I'm giving most everyone methylene blue, so I'm turning everyone's urine blue and fun party trick. But it seems to be one of those nice, pulls a couple of different jobs where, yes, it helps with biofilms and it's a big antioxidant and pulls out nitric oxide from the brain. So it calms down inflammation. We can treat certain infections like candida or other things that could also be setting up shop. So I'm always looking at ways of consolidating the treatment regimen and treating any patient, no matter their age, like a 5-year-old, for compliance, to say, okay, what can I get a 5-year-old to take? Right. And I'll apply that to everyone else. And then from there, we'll tweak it. But no, I definitely tap into those research nutritional herbals, methylene blue, glutathione's a big one for me if people tolerate it. So that's something that I give everyone if they'll tolerate, just for that massive liver detox and anti-inflammatory component of it. So, yeah. But other treatments, yes, ozone is one of them. There are a few caveats to treatment. You have to be very careful with it. There are certain patients that you can't give it to, but it's helpful in kind of ozonating the blood and really starting to kill off a host of things and also kind of boosting your mitochondrial function and overall oxidation. I use high dose vitamin C with patients, again, who meet criteria. There's some lab work if you have your G6PD levels are off, or if you're anemic, or, other issues, then we can't use it. But for those who can, it kind of reacts with certain minerals in your blood, like copper, and creates peroxide. And peroxide can kill a whole host of things, right? So it's not used as that kind of bougie antioxidant. Oh, I need to get my replenishment IV. It's doing something very different. It's no longer an antioxidant at certain levels. It's really an oxidative agent that's killing off a multitude of bugs. So I use that quite a bit because I can monitor patients very closely. And if there's an issue with it, I can quickly just turn it off. Where once you put things like ozone in, it's kind of there for a while. So it depends on the patient, but I definitely use a lot of different techniques. And then I also use SOT therapy, which is a whole nother discussion, but it's essentially a gene silencing therapy. So it sort of renders those bugs sterile that we go after.
That could be a whole nother episode.
A whole other discussion.
Diving into management.
Yeah.
So much fun, all the different things, and it really helps you individualize the treatment plans, right?
Exactly. Mm-hmm.
So, well, we could keep going all day long, but we're wrapping it up. You've provided so many clinical pearls just wrapped up in one podcast. It's been really, really enlightening. And so today we explored the complexities of linking pediatric tick-borne infections and neuroinflammatory conditions such as PANS and even autism spectrum disorder with Dr. Summer. So thank you so much for being here, Dr. Summer. I'm sure this is only the tip of the iceberg, and it's definitely piqued my interest and intrigue, and I'm really inspired to learn more. I'm sure our listeners are as well. So before we say goodbye, we're going to do a little bit of 3 rapid fire questions to lighten the mood and have a little bit of fun. Are you game?
Sure.
Okay, Jen, take it away.
All right, I'll start. If you could have one superpower, what would it be?
Oh, one superpower. Maybe to read minds. That's expected anyway. So easier.
That could be a good or a bad thing, depending on.
It could be good. I know. It's like, that's a slippery. Yes, it's already expected to read minds. So if I could just do it, make it easier on me.
Yeah, right. Probably with your patients, huh? Because then you
exactly.
Yeah.
Turn it on and off.
Yeah.
Okay. What about can't live without food?
What food?
What can you not live without for food?
And I love chocolate, but it's dark chocolate, so there's an antioxidant. I can totally, kind of flip that into something healthy, right?
That's right.
Dark chocolate.
Well, you're not the first one, I think.
Yeah, dark chocolate is my thing.
And then lastly, tell me a book you're reading right now.
Ooh, I'm actually rereading old books, old classics. So I'm actually rereading Kurt Vonnegut's Cat's Cradle. So I read it as a kid, as a teenager, as like a recommended, a required reading. And, in school, you just don't get the full effect of it. So I started reading some of the old classics again, just to kind of see perspective as an adult, as an enjoyable read. And is so much better.
Yes. I love
You get so much out of it. So much more out of it as an adult.
Yeah.
Right?
When you
Whenever you
revisit
read
those
all of these
topics.
books, I'm like, why did I like this before? This is amazing. You know, so.
Oh, wonderful. Well, Dr. Summer, again, we can't thank you enough. This was just an enlightening conversation. I've definitely learned a lot. Tell our listeners where they can find your website specifically and anything else that you'd like to reference.
Sure. So I do have an Instagram account. I'm not very great at it, but I have one. And it's at NY Limes with an S. And yes, I know it's plural. That's just how it worked out. So NY Limes and Pans. And then my website is HudsonValleyIntegrativeHealth.com. And then there are links to other things, blogs and other things there that will get you in contact.
Go look at that beautiful website, everybody. And that little child will just warm your heart. All right. Well, thank you again for being here. And thank you to our listeners. And we'll see you in the next episode.
Great. Thank you all.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.